Okay, let's talk about another conventional antipsychotic. Let's take Pimozide, Pimozide, or ORAP. High potency conventional antipsychotic used to treat Tourette's syndrome, and it has QTC issues, and that's why. Okay, let's talk about that. Okay, Pimozide, not used in USA, so it is dopamine receptor antagonist, of course. Conventional antipsychotic used for Tourette's syndrome and tics supportant. Okay, neuroleptic dopamine 2 antagonist. Commonly prescribed for suppression for motor and phonic tics in patients with Tourette syndrome who have failed to respond satisfactorily to standard treatment. So here we are. So it's mainly for motor and tics, and it can be used for psychotic disorders in patients who have failed to respond satisfactorily to sustained treatment. How it works, D2 receptors blockage. I will go through this quickly because I just want to know the special things about that. So how long until it works? Relief from tics may occur more rapidly than antipsychotic action, of course. So if it works, it is a second line treatment option for Tourette syndrome. It is a secondary or tertiary treatment option for psychosis or other behavioral disorders. Should evaluate for switching to an antipsychotic with better risk-benefit ratio. Okay, we know all the things in general, so let's just go. We have something to say about tests. You need baseline EKG and serum potassium levels that should be determined, and periodic evaluation of EKG and serum potassium levels, and serum magnesium levels, of course, that may be need to be monitored. Okay, what about side effects? Side effects are caused by dopamine receptor antagonism, anticholinergic, antihistaminergic, and antiadrenergic, alpha 1 receptors also are the causes, and the can explain these side effects. What we have here, so best augmenting agents for side effects. Augmentation of Pimozide has not been systematically studied and can be dangerous, especially with drugs that can either prolong QTC interval or raise Pimozide plasma levels. So you can notice we are talking a lot about QTC and ECG and such things. So that's why I'm going to go directly to the to some dosing tips. The effects of Pimozide on the QTC interval are dose dependent. So start low and go slow while carefully monitoring QTC interval. Treatment should be suspended if absolute neutrophil count below 1000. Overdose can cause death. Okay, deaths have occurred because of extrapyramidal symptoms, EKGs changes, hypotension, and respiratory depression, or even coma. Okay. Other things to talk about here are pharmacokinetics, because Pimozide is metabolized by CYP for 53A, and to a lesser extent 1A2, 3A, which is 3A4 I think, and 1A2. Mean elimination half-life is approximately 55 hours. About drug interactions, I will concentrate on things about QTC prolongation, So, and of course you should notice the the use of 3A4 inhibitors like fluoxetine and sertraline and such things can raise Pimozide levels, and because they inhibit the enzyme that is that metabolize this drug, and that would of course increase the risk for dangerous arrhythmias and EKG changes. And so use of Pimozide and fluoxetine may lead to bradycardia. It is okay. So that's it. Because Pimozide may dose-dependently prolonged QTC interval used with caution in patients who have bradycardia or who are taking drugs that can induce bradycardia, like beta blockers and calcium channel blockers, clonidine or digitalis. Okay. I want to talk about some two special populations to talk more about cardiac impairment. Again, Pimozide produce a dose-dependent prolongation of QTC interval, which may be enhanced by the existence of bradycardia, hypokalemia, congenital or acquired long QTC interval, which should be evaluated prior to administering Pimozide. Use with caution if treating concomitantly with a medication likely to produce prolonged bradycardia, hypokalemia, slowing of intracardiac conduction, or prolongation of the QTC interval. Avoid Pimozide in patients with a known history of QTC prolongation, recent acute myocardial infarction, and uncompensated heart failure. Okay. So here we have some things about the art of psychopharmacology. Potential advantages of this drug. We are talking about Pimozide again. Only for patients who respond to this agent and not to other antipsychotics. So you should not use this agent if you don't need it. Okay, so there's a lot of other agents, because we have some disadvantages because of the vulnerability of some populations like children and elderly and patients on other drugs, because of many interactions because of the enzyme systems that is involved here, and even the QTC thing. Primary target symptoms are vocal and motor tics in patients who fail to respond to treatment with other antipsychotics, and psychotic symptoms in patients who fail to respond to treatment with other antipsychotics. So I think if you need to use this drug, you use it for vocal and motor tics. Okay, not for psychotic symptoms, because you have many more other options. Some pills in the past was a first-line choice for Tourette syndrome and for certain behavioral disorders, including monosymptomatic hypochondriasis. However, it is now recognized that the benefits of Pimozide generally do not outweigh its risks in most patients. Because of its effects on the QTC interval, Pimozide is not intended for use unless other options for tic disorders or psychotic disorders have failed. So it was a first-line treatment for Tourette syndrome and tic disorders, but now it's not. So that's about Pimozide. If you need to read more about that, you can check these. So that's it.